Hello, welcome back. The video topic today is anemia in elderly people. Most of the elderly people think being anemic at this age is okay. No, not at all. Any age you cannot be anemic. That's for sure. And if you're elderly, at least keep your hemoglobin more than 11. That's very important. Why? Because you need blood and hemoglobin for a normal function and healing of any tissue and for healing of any disease. And even your drug to act, you need blood. The blood is the one which carries the drugs to everywhere. So you need certain amount of blood and hemoglobin for a normal function for any age, for that matter. Okay, fine. In elderly people, the study says 80% of the elderly people are anemic, and most of the reason being chronic diseases and nutritional iron deficiency. These are the two reasons. Okay, apart from that, vitamin B12 deficiency, folic acid deficiency, and very importantly gastrointestinal bleeding is also very important reason. And of course elderly people, the reason being cancers. Okay. So how to approach these people? First, we cannot accept being elderly. They can be tired, he's always sleeping, he's very tired. Okay, that is because of the age. No, you cannot say that, number one. Number two, and because I am very old, it's okay to have a hemoglobin, less hemoglobin. No. If they are very tired, always sleeping, memory loss, and it takes longer time for any disease to get cured or getting easy infections, these are the signs of anemia. So go to the doctor, let your family physician examine you, ask questions, and definitely will run a test, very simple blood test that will show your hemoglobin is low, your RBC count is low, your blood volume is low. They will find out, and they look for what could be the reason. The first reason, as I said, any chronic diseases, like suppose you have a kidney disease, so they will be mostly anemic, and rheumatoid arthritis, tuberculosis, cardiac disease. These are all the very common chronic diseases can give you anemia. So treat those diseases if needed, get supplements or blood transfusions if needed, so that if you have a good amount of hemoglobin, these diseases also can be easily treated. Number one. Number two, nutritional deficiency, iron deficiency. So most of the elderly people, as they get older, the amount of the quantity of food usually goes down, and they prefer a simple daily same food. Like suppose they like idli, they take only idli because it's very easy to digest for them. But this leads to nutritional deficiency. Most of the vitamins can be deficient because of the same food or simple food. So and the reason they say, okay, I'm very old, or my father is very old, so he is taking less food. No, for the age, for the height, weight, some calorie or some amount of food is very important. So this has to be seen. And if it's because of the nutritional deficiency, definitely he needs iron supplements or nutrition vitamin supplements. Number two. Number three, again other vitamin B12, folic acid deficiencies, if it is there, it has to be replaced. And very important is the gastrointestinal bleeding. Most of the time, that is why we always say any elderly people always look your motion. If the motion is black, that means you are bleeding somewhere. Or always look when you are passing the motion, drops of blood. So bleeding can be anywhere from foot pad to anus. So if it happens in the stomach, because of gastric ulcer, or even because of the tablets, especially aspirin or cloplet, or even other drugs, there are blood thinners. They easily cause bleeding. Okay, and suppose they have a cirrhosis liver, again chance of bleeding is varicose bleeding is very high. And not only that, suppose for rheumatoid arthritis, for any disease, they are taking steroid tablets, they can erode the stomach, and that causes ulcer bleeding. So this is one part. Most of the upper part bleeding comes out like a black motion, and as it goes lower down, the color changes from dark blood, bright blood, then the lowermost, like piles. If you have a piles, then you will have a fresh bleeding. So this is how. And always even the previous videos we are told, if you are above 40 years and first time you have a bleeding in the anal region, don't think it is a piles. Always do a colonoscopy, rule out any cancer, especially cancer rectum. Okay, it's very important. So gastrointestinal bleeding and most of the stomach cancer, the presentation is hemoglobin of 5 and 6. They may not have any symptoms at all. Elderly people, the only presentation will be hemoglobin of 5 and 6. That means almost we can say it could be because of stomach cancer. So these are the causes. So the doctor will run simple blood test and will look for what could be the reason. It's a nutritional or disease. Then what to give, whether supplement or treat the disease. If it's a supplement, I always say elderly people cannot tolerate iron tablets. Most of the time it gives gastritis, motion will be very black, the motion will be smelly, flatulence, too much of gas, so they avoid all this. So better to give iron injection, infusions, that is best, or even sometimes blood transfusion if required. Okay, so anemia elderly, we cannot take it as a simple one, and it needs to be evaluated and treated accordingly, and especially if it is a chronic disease and iron deficiency, it needs more attention. Thank you.